Hi, doctor. Have you wondered what the secrets are behind the leading national implant center, which is the literal 800-pound gorilla in the full arch case segment, and other practices like yours or other small independents or small DSOs? Now, undoubtedly, you see Mr. Gorilla's TV commercials, or your patients see those and they ask you about them. So, what's their secret behind why they treat so many arches, so many cases compared to everybody else? I'm Dr. James McAnally, founder of Big Case Marketing, a specialty ad agency focusing just on full arch implant cases. With more than 30 years in the profession and 17 years overseeing implant case advertising and sales, I have some direct insights that I would love to share with you on this very topic. Now, popular opinion among implant clinicians is that the big secret is just in the advertising seen on TV. Popular opinion, of course, is often wrong, and it is dead wrong in this case. Yes, Mr. Gorilla has great TV ads, but those are easily duplicated. This can be easily duplicated and look just like this, just as Fortune 1000 as the Gorilla's ads. So that's not the real secret for why they treat far more cases than 90% of independents, small DSOs, and specialists combined. So I would love to share with you a free 20-minute informative discussion exactly how the Gorilla does all of that and how it makes a difference between them and you. In this discussion, we'll cover 6 key factors of success. Now, most practices can get these. Some of them have the key factors now. Some of them can get them from vendors or via changes in their admin processes. In fact, you probably have some of these factors already, but you're also probably missing some of them. But which ones? What's going on? Now, by the way, since advertising is, yes, indeed, part of the secret, we will talk about entry price points for Google advertising and TV advertising that predictably generates full arch implant cases every month in the post-pandemic economy. Now, more importantly, we're going to cover a hidden factor that independents and small DSOs and specialists don't really understand, much to their detriment, what I call the S factor. It is the single biggest secret driving success for the 800-pound gorilla and for other practices who treat a lot of arches right now. So what's your S factor? Well, even before we get to this discussion, I would love to give you a free tool that lets you go ahead and start evaluating where you stand in this very specific factor that impacts the cases that you do now and that you will do in the future. As part of getting access to this special discussion, I'm going to send you the assessment for free. Now, while we're talking about the S factor, how important is this? Well, it's so important that 2 practices can both have the same 6 keys to success, but the practice with the high S factor will treat far more cases per month compared to the one without it. It literally can mean the difference between 10 arches per month and 0 arches per month on the same ad budget. That's just how important it is. It's also the one factor that separates the most spectacular advertising success stories from absolute dismal failures. And I can objectively state that it's the case with our client base of hundreds over many years. This is also a factor that other advertising agencies besides us really don't want to tell you anything about, but that's another story. Now, lastly, the same S factor and the lack of is why a lot of implant practice owners and DSO management companies are constantly changing advertising agencies or marketing companies as if they were changing horses on the circus carousel. Yes, ads make a difference, but if you're rotated through 5 agencies in 5 years, especially reputable agencies, it is not your advertising's problem, doctor. Now, if this last statement describes you, then this discussion will be even more financially relevant to your business. Now, as they say, knowledge is power. And in the business of implants, knowledge on the clinical side is power to do good patient treatment. And it's also power on the business side to have business success. This knowledge about the key factors as well as the S factor means a world of difference in returns on advertising, the excitement of treating a lot of fun cases, and how many patients are helped by all of these amazing procedures. Now, again, I want to invite you to this free discussion where we're going to cover all these factors that make a difference. You get a complete understanding of what's going on with the 6 key factors as well as the S factor. As part of that discussion, and before the discussion, I also want to send you this free self-assessment tool that helps you figure out your S factor right now. Now, how do you go about accessing the free discussion? Well, to do that, You simply go to the link that either came with this message, or you go to this address. Both of them will take you to the same spot where all you have to do is complete the information. You will get instant access to the free discussion. And after we verify your information, your name and practice, then we will send you the self-assessment tool by text message. Now, doctor, if you have a serious passion for dental implants, I trust this has made you very curious. I'll look forward to hearing from you after you attend the short discussion and after you perform your S-Factor self-assessment. Again, Dr. James McAnally, founder of Big Case Marketing here. Thank you for your attention. And you.